Hello and welcome. I'm Dr. Alan Lawrence. Today we're going to talk about contraception, pregnancy prevention. This is program number 2, birth control methods, natural and barrier contraceptives. This presentation is presented by Health Education Associates of Palm Springs, California. Come, join us and learn more about the benefits and risks of contraception. What is contraception? Contraception relates to the prevention of conception, hence pregnancy, sometimes also called birth control or family planning. What are contraceptives? A contraceptive is any process, device, or method that prevents or interrupts conception and or implantation of a fertilized egg within the uterus. Why use contraception? Primarily to prevent unwanted pregnancies, but also to control when pregnancy occurs, to prevent the need for abortion, and to maintain control over your life and overall well-being. There are many methods of contraception currently being used. The most commonly used methods of contraception are abstinence, natural contraception. This includes withdrawal, basal body temperature, cervical mucus, and following signs and symptoms associated with ovulation. Barrier methods. These imply the use of physical methods such as condoms, diaphragms, and cervical caps, chemical methods such as spermicidal jellies, creams, and foams, and physical chemical methods combined. Hormonal steroidal methods. This group is made up by oral contraceptives or birth control pills, of which there are many different types, non-oral contraceptives such as Depo-Provera and Norplant, which we'll discuss in just a small bit of time, emergency contraception or the next day morning after pill, which is usually a potent hormone that changes the ability of sperm and egg to meet, survive, for conception to occur, implantation, and fertilization are all potentially blocked or limited by these potent hormones that are given immediately after having sexual relation. A second group is the mechanical or surgical group, and this includes the intrauterine devices, surgical or permanent sterilization such as tubal ligation, hysterectomy in women, vasectomy or removal of testicles in men, and finally, a much disputed method of contraception, abortion. In the next slide, we look at ovulation and impregnation. This is a summary of what was previously learned in slideshow program number 1, Contraception, Pregnancy Prevention, the Basics of Birth Control. Here in this slide we see ovulation occurring, the egg then entering into and transiting the fallopian tube. At about mid-portion of the right tube we see fertilization occurring. Then the egg enters into the uterus, and if fertilization was completed and an adequate zygote was created, the fertilized egg will then implant, burrow into the lining of the uterus, the endometrium, and at this point implantation is said to have occurred. In the next slide we look at the stages of menstruation. Here, the menstrual cycle is portrayed in a slightly different perspective, where the ovary and the various stages and processes that occur within it are shown to be above the lining of the uterus, which is the box below, so that we can see that they are synchronized and how they can work effectively when they are synchronized. When we talk about birth control pills, we will discuss that this cycle is interfered with and that the production of LH, FSH, estrogen, ovulation, and hence fertilization are also interfered with, and pregnancy can effectively be prevented. One commonly used method of protecting against pregnancy is abstinence. This is simply not being sexual. Abstinence implies not being sexually active, of course, but most specifically not having intercourse. That is, where the woman allows a male penis to enter into her vagina. When the couple is not sexually active, there is no ejaculation into the vagina, therefore no sperm will be deposited in the woman's vagina, hence fertilization is unlikely. When we look at natural methods of contraception, we find that there are a number of them. Most of these methods tend to operate under the name of a rhythm method, and there's many different ways that rhythm can be used. One of the most common is by taking basal body temperature and noting that just before ovulation there is a slight drop in temperature and then a rise right after the ovulation has occurred. There are also physical signs and symptoms that many women will recognize as indicating they are near or about to ovulate. One can also use calendar dates, although this is not highly reliable, but for the woman who is very regular, it can be used effectively. Another rhythm method may require the testing of cervical mucus, or the woman reaching inside the vagina, pulling out a small sample of mucus, and actually looking at it or putting it through several tests to determine whether ovulation is about to happen or has already happened. Using basal body temperature to guide you, one can generally determine the rise in the few degrees prior to ovulation. And knowing this, one can deal with the fact of not having sexual relations if one wants to prevent pregnancy, or on the other hand, can use this information to become pregnant. So basal body temperature has two values. One is for contraception, the other is for fertility and helping the woman to become pregnant. Withdrawal. Some couples may use a method called withdrawal. In this situation, the couple starts having intercourse, but as the man comes close to ejaculation, he pulls out so that he does not have to ejaculate into his partner's vagina. With withdrawal, the male partner simply withdraws from the vagina before ejaculation. With withdrawal, the couple may be sexually active in every way except that either the male pulls out or the female pulls away, breaking the penis-vagina sex contact prior to ejaculation. This is not an extremely reliable method of contraception, as even small amounts of pre-ejaculatory fluid can contain large enough amounts of sperm to lead to pregnancy. Withdrawal differs from abstinence in that with abstinence there is no intercourse as well as no vaginal or other sexual contact occurring. Some couples may only use withdrawal on those days when the woman might be fertile or may become pregnant if ejaculation did occur. This is a kind of a rhythm process wherein the combination of rhythm with withdrawal is used together. Withdrawal is safest when used with a barrier method, such as condoms or diaphragm or foam or such that would help protect against the leakage of small amount of fluid with sperm prior to ejaculation. Spermicidal chemicals. Spermicidal chemicals come in many different forms, including vaginal creams, foams, and lubricants that have a spermicidal effect, killing the sperm, hence blocking the ability of the woman to become pregnant. Spermicidal chemicals have some degree of value in protecting against sexually transmitted diseases, as of course does condoms. This advantage should not be considered a main reason for using spermicidal creams or jellies or foam for prevention of STD, but as a secondary advantage using it as a method for birth control. Douching after intercourse is not an adequate method of contraception and should not be used for this purpose. Combining barrier and chemical methods. When barrier and chemical methods are used together, they are much more reliable protection against impregnation than when either is used alone. They are also much more reliable for protection against STD when used in combination. Condoms. Condoms are animal skins, rubber, or latex skins which have been placed over the top of the shaft of the erect penis prior to starting intercourse. Their main role is to act as a barrier to prevent sperm from entering into the cervix, causing pregnancy. There are dry and wet condoms with and without spermicidal chemicals. Condoms, unlike diaphragms and cervical caps, can also prevent the transmission of sexually transmitted diseases, STDs. The effectiveness of condoms can be increased by using spermicidal foams, jellies, creams, or spermicidal impregnated sponges or suppositories when they are placed within the vagina 20 to 30 minutes before starting intercourse. They may be used alone or in combination with the barrier contraceptives, such as the diaphragm and cervical cap as well. The diaphragm. The diaphragm is a domed-shaped piece of rubber which is inserted into the vagina at least 30 minutes before sex. It has a flexible, flat or round spring around its rim. The spring allows the diaphragm to open up and cling to the wall of the vagina so that it can act as a barrier and not allow sperm cells to go around it to cause fertilization. When used alone, it is effective, but it is much more effective when used in combination with a spermicidal substance such as foam, jelly, or cream. Diaphragms come in various sizes, so just about any woman could be fitted for a diaphragm. They do not protect against STDs, while the spermicidal component might. Diaphragms are easy to insert and easy to remove. They are an excellent form of contraception for the woman who wants a relatively low-risk method of contraception, and pregnancy is not a problem should it occur. The cervical cap. The cervical cap is a specially fitted rubber device which, like the diaphragm, is inserted into the vagina around the cervix. It acts as a barrier to preventing sperm from entering into the cervix and therefore prevents fertilization and impregnation. It is also used with spermicidal chemicals for a most effective method. It is placed into the vagina onto the cervix at least 2 hours before intercourse. Why choose one method over another? Most women will use several methods of contraception during their fertile years. The method they use at any one time is likely to be based on a number of factors. For example, their need to protect themselves from becoming pregnant, obviously, number one. Their past experiences, good or bad, with other methods of contraception can also affect their final choices along the way. What is available to them at the time when they are looking for a contraceptive method is also another powerful factor as to what method is chosen. Other factors that will affect the choice of contraceptive is what can the individual afford, their personal beliefs and preferences about contraception, pregnancy, abortion, and sex. Personal comfort and desires play a role. Desire for a temporary or permanent method may significantly affect their decision-making processes. Also, their partner's needs and beliefs must play a role in final decisions along the way over many years. If you have questions of which may be the very best method of contraception for you, we make 2 further suggestions. Watch programs number 2 and 3 for additional answers regarding methods of contraception. And 2, talk with your doctor. He can be a font of information as to finding the best method for you. We hope that the information we provide provides the best information for you to create the happiest family you can. Thank you for watching Contraception Pregnancy Prevention Program Number 2, Birth Control Methods, Natural and Barrier Methods. This has been a presentation of Health Education Associates, Palm Springs, California. For information about contraception, its use, benefits, and risks, go to holisticgynps.com/contraception. This production was written by Dr. Alan Lawrence, edited by Lisa Robin Lawrence, Ph.D., and was produced and directed by Dr. Alan Lawrence and Dr. Lisa Robin Lawrence, Ph.D. Thank you. Have a wonderful day.